put this right here, okay? Now, with the male patient, I'm going to open my kit, and guys, the way we're going to do it is females will check off on the female mannequins, males will check off on the male mannequins. All right?
That is so not fair.
When we open our kit, the first thing we encounter, now to prepare the drapes for a male patient, usually they will have their gown here and their covers. We'll pretend that this is his bottom sheet here. So we really don't have to have that back blanket. You can have a back blanket up over the chest to keep them warm if they have a tendency to get cold. But if I fold back the sheets just that far so that this area is uncovered, right? So when I open up my kit, and I don't have on my gloves yet, remember I was going to hold this like a pizza? I had it this way.
No, okay.
Right. Take it and drape it. It's not going to go up under the patient's hips, all right? Because what we're working on is anterior, not down here. So you're going to take this and just lay it over the penis. If the penis is not exposed, don't worry about it right now. Okay? Then we're going to put on our gloves, sterile gloves. Don't get this on video because you sure are not seeing sterile technique.
Yeah,
You get the point.
we get the point.
Then we're going to have the fenestrated drape. Touch the side that's not next to the patient. The fenestrated drape works really well on the male patient. Just lay it over. And most students will contaminate when they start doing this little deal. Don't pat it, just leave it alone. All right? Then we got our kit ready, and everything else is the same from here on out. When you're going to clean the patient, I'm going to contaminate my non-dominant hand anyway. This is the time where you can, make your adjustments with the drapes and the sheets. Grasp the penis firmly. You want to hold it at a 90-degree angle to the body.
Very important. 90 degrees.
Why?
It's the way that
The urethra.
runs.
Okay.
You don't want to be going like this because then you would.
You have to go down and around and back, so straight up.
Okay.
90 degrees.
And you want to use a firm grasp.
Because I heard that keeps them from getting an erection.
Correct.
Okay.
All right. So you're going to grasp, hold it up 90 degrees. We're going to clean, around,
One,
drop. You see how I'm going over my arm instead of under my arm? Why am I doing that?
Keep your uniform getting messed up.
To keep it from being contaminated. If I go under my sterile hand,
Oh, yeah, that's right.
Yeah.
Okay.
do you see how that is going? So clean, drop, clean, drop, clean, drop. Now you're going to insert. They used to say 6 to 8 inches. That's typical length of the urethra, and it is. But now they're saying to go all the way to the bifurcation. The bifurcation is that V.
Right
see
here.
the Y? You're
Right there.
Okay.
Okay? Mr. Jones, take a deep breath. I don't know if it's going to go in him.
Well, you can't go.
I'll
you shouldn't
feed it
go
in here.
like that. Okay. But you're going to get urine. No matter when you get urine, you go to bifurcation on the male.
So you're going to go,
That's
keep
the lesson.
going,
Did you get urine before then? You
all
keep
the way
going?
to the V.
And then wait to see
Make sure
urine.
that it's
You probably will see urine coming out
Before it is.
before then, and go all the way to the bifurcation. I've got urine coming out. Then I can take my non-dominant hand, because my sterile procedure's over, right? Hold the tubing, come over here, and inflate.
So you leave it at the V.
Gonna inflate the balloon. Once I get the balloon inflated, I can let go, detach it, then pull it,
Until you feel
Till you feel- Okay.
Okay.
because you want the balloon sitting in the base of the bladder. We don't want it to traction.
Yeah.
There are situations where they do want it to traction for certain bleeding and to tamponade that area. But we just want the balloon to lightly sit at the base of the bladder.
You're gonna pull into it. Don't-
Resist.
And
General resistance.
general resistance. And then you're going to tape it in place or use a leg strap with a little bit of slack. Okay. Any questions?
Now, the leg strap would be a separate component.
Leg
separate
strap is
piece.
separate. We can just use a piece of tape.
Yeah.
Silk tape. And sometimes what they'll do is they'll take a piece of silk tape and do kind of like you did with your sterile field. We could put a little barrier, put there, and then tape it. Yeah, that's right. That's gonna go. Now, I'm glad you mentioned the charting, because with the charting, you want to chart what you did, what size catheter you used, what you got back. Now, how would we describe what we got back? How much? Immediate return of 30 cc pale yellow
Right.
urine. Can we document the odor? You won't
Yeah.
smell it
Yeah, it's
because
not
this
bad.
is a closed system. Now, if we were emptying the bag, then you could smell it if we had a urine. And that's another good thing to chart if you obtained a specimen to send to the lab. If they've got an infection, you will smell it. Or if they're on antibiotics, the antibiotics have a very strong odor.
Or if they've eaten asparagus.
Or if they've eaten asparagus. And how the patient tolerates. How would we document how the patient tolerates?